Again, Happy New Year to all of you, and welcome to our first show of season 2. I hope everyone had a wonderful holiday season. Last week we had a rerun with Chef Babette, and I hope you enjoyed that show. Today we have a special topic. It's going to be led by one of our panelists, and I'm going to bring her on shortly. But just a word of introduction. As I said, this is the first show of the second season, and we're going to be coming up with a number of different ideas this season. We're in 2021, and so I'm excited about the different topics we're going to talk about. COVID-19 is still on the run, and we're going to have some topics, some shows to address that, particularly next week, to help individuals address the issues with their immune system. I want to have you stay tuned for that. But a lot of other shows will come on. We may go into some of the topics that we covered last year and break them down into more detail. So I'm really excited about the second season, and I hope you look forward to it as well. I do recall our last show of last season. Many of our listeners wanted us to give some insight into our routines through the day. So through the course of this year, we'll probably bring some of that insight to you. So anyway, I want you to stay tuned. And again, thanks for joining us tonight. And we're going to be talking about adrenal fatigue. And this is an interesting topic. I see a lot of patients who come in who are tired and worn out and feel somewhat wiped out. And, we check their blood pressures and everything looks okay. And adrenal fatigue is one of those conditions that it can hide in the background, if you will. But it's something that's a very common disorder. And we're going to talk to you today and cover this very, very important topic of adrenal fatigue. But before we go to that, I'm going to bring some of our panelists on. Celeste, how are you today?
I'm well.
I imagine your day's busy and you had a busy holiday season, or did you have a quiet holiday season?
I had a quiet, relaxing holiday season because no travel.
Good.
We do what we have to do.
I didn't travel either, but I worked, so I don't know. That's okay. Better than working, not working, so I better not complain. And Dr. Floyd, how's it going?
Oh, I'm doing fine. How are you doing today?
Just fine. You always had a beautiful artwork behind you. So I take it you had a restful holiday weekend, a holiday period?
I can't tell you how restful it was. I wish I could do it again.
Well, I'm sure you will. So that rest is good for your adrenal glands. Well, our speaker tonight is Dr. Pam Atkins. She's one of our regular panelists. And I asked Pam to give us lead our discussion on adrenal fatigue. She is an expert in hormone regulation in men and women, and adrenal fatigue is one of the areas she deals with on a regular basis. Dr. Atkins is director of the Center for Wellness and Healing, founded by her and her husband, Dr. Floyd Atkins. She provides knowledge and solutions to people facing various health challenges. She is graduate of Howard University in 1984. She went to University College of Medicine and got her training in family medicine, completed family practice residency at Howard. So she's trained as an allopathic medicine, although she practiced as a functional medicine physician. She has 25 years of experience ranging from emergency medicine to private practice. She focuses on an integrative approach, blending traditional care with holistic care to ensure the best outcome for her patients. Currently, she's the medical director of the Center for Wellness and Healing. She provides patient-focused healthcare directed toward prevention and wellness. She has authored magazine publication, is a lecturer, and speaks nationally and internationally. She was designated Doctor of the Year by the Alternative and Integrative Medical Association in 2007, honored by Houston Health Book for outstanding community work in health and wellness in 2009, and acknowledged by numerous organizations for her service in the community. She is a member of the Alpha Kappa Alpha sorority incorporated. She's a wife, a mother, and a role model to others seeking to make a difference. So without further ado, Dr. Pamela Atkins, how are you today?
Hi, good evening. I'm doing well. Good to see you all. Good to be here.
I think about this topic of adrenal fatigue a lot. And, some of my heart failure patients, are very challenging. And I have a theory that many of them have adrenal fatigue. And, of course, they have a lot of things going on, but, they have low sodium and have low blood pressure and so on. And these can be signs of heart failure in itself. But I think there's a subset of them that are suffering adrenal fatigue. And I'm hoping this discussion will enlighten me in some way in terms of some things I can do to look at their condition and maybe to address it in some way, form, or fashion. But that's certainly one area that I'm perplexed with regarding the adrenal glands. So I look forward to your topic tonight. So adrenal gland fatigue, insomnia, fatigue, and depression, all of these things can be associated with it. So as we kick off, what are some of the issues? How should we, let me just bring up your slides here. And if you can just lead us in this topic, I'll put you up top here, of the role of the adrenal glands. So, where is this? How big of a problem is this? Let me just open with an open-ended question.
Yeah, we find that as many as 80% of individuals will be have some underactive adrenal symptoms in some part of their life. And I would say
80%.
80%.
Wow.
And so because we live in a stressful society, a lot of stress factors are going on, and things get more and more complicated. And then they throw in, a pandemic, and it's even worse. So, that's what we're going through. So it is very common, and it may be mild, it may be moderate or more severe, but there's some form of adrenal fatigue. And we see it often.
Wow. So why don't you get kicked off here? So the role of the adrenal glands. So what's the physiology and pathophysiology of our adrenal glands? Why don't we get started here? Because a lot of people don't think of the adrenal glands. They think of the heart and the kidneys and all of that stuff. The adrenal glands are just hidden back there. Mm-hmm. They play an important role. Yeah. I remember in medical school, as one of the physiology professors was saying, the adrenal glands, you got the three layers, and the outer layer handles the hormones that deals with salt, and the middle layer handles the hormones that deal with sugar, and the inner layer handles the hormones that deal with sex. And so he says, the deeper you get, the sweeter it is.
That's an interesting way to look at it, to remember.
But anyway, I thought I'd kick us off with that. That's the only thing I remember from med school about it.
Have us chuckling.
So anyway, the role of the adrenal glands, kick us off here.
So I just entitled it, Why Am I So Tired? And there's so many reasons for why we're maybe fatigued or tired, but adrenal glands is one. And so we want to look at that. Certainly, we always want to know we're not having sleep apnea or something like that going on, but we're going to look at the adrenals today. And so in starting, we are looking anatomically, what are the adrenals? They're small little glands. They are triangular size, or sometimes they're pyramidal size shape, and they are on top of the kidneys. And the size, the right is a little bit smaller than the left. The right can range from 4 to 11 millimeters, and the left 5.3 to 13 millimeters on average in adults. And they produce several hormones and substances, as many as 40 to 50. But the most important ones in the cortex are glucocorticoids, which is cortisol as one, mineralocorticoids, which is aldosterone, which handles our salt and maintaining blood pressure and cardiovascular, and cortisol helps with keeping us alert and energetic. There's also the sex hormones, as you mentioned, the testosterone, DHEA, estrogen, progesterone. And in men and women, we have the same hormones, just different levels. And did you know that 40% of our sex hormones are made by the adrenal gland? So that becomes very important in women when there's menopausal, perimenopausal symptoms, if we have some adrenal issues or adrenal fatigue. And the adrenal medulla makes the norepinephrine and the epinephrine, which helps us. The epinephrine is just that flight or flight hormone, and the norepinephrine maintains healthy cardiovascular function, blood pressure. And there's a protein called progranin A, and that is one also. So those are good highlights of what the adrenals are making. And so we'll move on from there. And I wanted to touch briefly on Addison's disease, which is adrenal insufficiency, when the adrenal is not working well, or sometimes some people call it adrenal failure. But Addison's disease is adrenal insufficiency, and it was first discovered by Thomas Addison, who was an English doc in 1855, and he discovered this condition. He was looking at the supraadrenal glands, which is what they called the adrenals back then because they're located on top of the kidneys. And he was investigating this peculiar anemia called later diagnosed as pernicious anemia. And he noticed there was fatigue, there was weakness, there was a irritable stomach, GI problems, some skin color changes. And pathologically, when he looked at the adrenals on autopsy, he found that there were changes in the adrenals. So he first discovered Addison's disease, and it has his name. When we talk about the causes of Addison's disease, 2/3 of Addison disease, as much as 66%, is felt to be due to an autoimmune cause. And so autoimmune disease is a big cause, particularly in the United States. And because autoimmune disease is on the rise, that this may become more and more a problem, but it is rare. TB, infection with TB that affects the adrenal glands or the pituitary, that can be another cause, especially in developing countries, not so much in the United States, but we want to keep that in mind. And any kind of damage or injury to the adrenals may be also of concern. We also have to think of adrenal collapse or non-function with people chronically on steroid use for different reasons, or overuse or abuse. If they have been taking it chronically, and we know as docs, if they suddenly stop it, it can be very dangerous because the adrenal glands have kind of gone on vacation, and so they're not ready to respond and to keep us alert. And so that can be life-threatening. The symptoms of Addison's disease, some of the symptoms overlap with adrenal fatigue, which I'm going to discuss, but some can be life-threatening. But there's muscle weakness, fatigue, chronic type of fatigue, fainting, low blood sugar, joint pain, salt cravings, vomiting, diarrhea, hair loss, headache, decreased libido, dry skin. But the ones in red, the weight loss, the dizziness, the low blood pressure, that's fairly unique compared to adrenal fatigue. These symptoms can be pretty severe, and we need to be aware of it. Now, just some history and diagnosing and the history of some Addison's disease. We know President Kennedy was said to have Addison's disease, and I understand that they said when he was in England and he was there and he had a syncopal or passed out episode that he passed out, and he was diagnosed from a doc there in England that he had Addison's and started on a corticosteroid, and that was in 1947, and in 1955, he was later diagnosed with thyroid disease and placed on a thyroid medication. It is believed in retrospect that he probably had an autoimmune cause for that, because it's rare to have those two without an autoimmune disease. but that was President Kennedy. And diagnosing Addison's disease, there are some tests. Usually it's diagnosed by the endocrinologist. Some internists may do it, but you have to have an injection of an ACTH hormone to stimulate to see if any cortisol is made. So when that stimulation test is done and you see cortisol increase, that's considered showing that the adrenals are working. So that's diagnosing whether to diagnose Addison's disease or saying you don't have Addison's disease. The concern is what happens in between when you don't have it, but you still have some symptoms. There's also an insulin-induced hypoglycemia test. Also, there's a CAT scan and MRI that's sometimes done on the pituitary to see if there's some type of lesion or cause that the pituitary is not stimulating adrenal, or if it's adrenal gland, the imaging on the adrenal gland to see if the gland is too small. So, yes.
Real quick, so the ACTH stem test for Addison's, could that be positive? Some other adrenal, like somebody with adrenal fatigue, might they have an abnormal ACTH stem test, or will they not have enough adrenal depression for that to be positive?
Well, in adrenal fatigue, it is not profound deficiency. Their adrenals are working, but working less. So this test is not sensitive enough to pick up something like this. This is just to pick up that profound test. So it's like feast or famine. In conventional medicine, these are tests we use. So many patients are turned away and saying, there's nothing wrong with you, your adrenals are working. But we don't, but they're in conventional medicine, we don't have a lot of information to test whether the adrenals are slacking. And so that's the concern. And then for Addison's disease, the treatment can be prednisone and mineralocorticoid to take the place of aldosterone, and also salt replacement. So that is Addison's disease. I want to oppose it to adrenal fatigue, and so we're going to show the difference here. Okay, so the history of adrenal fatigue, Emile Sargent, it's a doc in France, that noticed that his patients took longer to recover from influenza, had prolonged symptoms. I guess it sounds sort of like COVID sometimes, and had increased need for salt intake and were lethargic. And so he wrote articles from 1917 to 1925, identifying this disorder that he saw, and we think that he was a precursor to the adrenal fatigue. He was noticing this very early. Then came Dr. James Wilson, who is a chiropractor and a naturopath, but he coined the term adrenal fatigue in 1998, and he followed up with a book called Adrenal Fatigue, the 21st Century Stress Syndrome in 2000. And he kind of directed that book more to patients, and because he, in conventional medicine, they did not recognize adrenal fatigue. And so this has become a dilemma. Adrenal fatigue has no diagnosis code. And so if it has no diagnosis code, modern medicine hasn't really embraced it, or conventional medicine hasn't embraced it. And so when there is no code, then, and the reason there's no code, I think, is because there's no treatment, in medicine. When we don't have treatment for it, we don't recognize it. So, when I think of things, you say, well, how do we handle other conditions? Like, when blood pressure is elevated, the difference between pre-diabetes or diabetes, the precursor, or if you have GI symptoms, maybe IBS, or, also when I look at these symptoms, when I look at these symptoms, a lot of doctors, maybe address, what I'm saying is, if you have some fatigue, may think they'll look for hypothyroidism or stress. They may diagnose you as anxiety or depression, but when you have these symptoms, many times you leave the office with a whole bag of medications, looking at each individual symptoms for those doctors that are listening and want to do something. But the more medication increase the risk for adverse reactions and drug interactions. So, but we may not be getting to the bottom of the cause or the root cause. And so I ask questions. Why are we not recognizing a decline in adrenal function way before Addison's disease is diagnosed? What happens before Addison's disease is diagnosed? And what happens before the adrenals fall off the cliff? Are there any telltale signs? So, yes. And so the causes of adrenal fatigue, stress on the body, basically. I mean, can be profound grief, can be chronic infections, some going undiagnosed, environmental toxins or stressors. It can be stress, whether it's job, whether it's unhealthy work environment or a stressful employer, family stress, financial stress, relocation, commuter stress. Some people travel for their job. All these can be profound stressors. Moving to a new location. For women, menopause, perimenopause, and as I remind you that 40% of our sex hormones are produced by the adrenals. So if a woman goes through menopause or perimenopause where the ovaries are not making hormones as much or stop making, it can be profound if the adrenals are sluggish and not working as well.
So how long does it take for some of these things to have an impact? I mean, in your experience, I mean, I guess it's hard to kind of put a time mark, but is this something on the order of months, weeks, or years, or does it matter of the level of stress you're having? I mean, I'm looking at some of these things and, long work hours and that type of stuff I can identify with. But so how long does it take typically to kind of wipe your adrenal glands out?
Well, you mean to get to Addison's disease or causing adrenal fatigue?
Well, say adrenal fatigue, like
okay.
Early to mid-level adrenal, to where you're symptomatic.
Yeah, I mean, it can be in terms of weeks to months, that it can happen as a short period of time. But like I said, first it may be mild and then more moderate and severe. But I mean, we live in stressful environments. We have a lot of family issues, and we have work issues and health issues. Yeah, and so many things. I mean, from dental inflammation, dental infections, and diet, processed food. High fructose corn syrup and the processed oils and high sodium content, chemical sodium that's not good salt, like good sea salt or pink salt, lack of sleep, excessive work. So these things add up. So we need to learn to look for these symptoms and to learn how to nourish our bodies so we don't fall in a hole.
I like that picture with the battery at the top. I mean, the adrenal glands are like a battery, and we need to recharge it, I guess. Is that a good?
Exactly. And we do need to recharge. So symptoms of adrenal fatigue, many times there's weight gain as opposed to Addison's disease where there's weight loss. There's more dependence on caffeine and alcohol to an excess, and that's not good. There can be blood sugar borderline or hyperglycemia or risk for diabetes. And there may be some hypoglycemic episodes because many times when our blood sugar is fluctuating, we crave more starches and sugars and the blood sugar goes up and insulin is secreted and we have periods where it goes down and we have these slumps. And especially people that drink caffeinated beverages, we put sugar in it and sweeteners in it. So we're going on that roller coaster there. The patients often have recurrent URIs or upper respiratory infections, sinusitis, fatigue, lack of energy, have some slumps of energy. Many, have might find energy waking up, not as much energy waking up, hard time waking up. The people that need that caffeine to start, or that Coke, or that starchy, sugary foods to get started, because they have that slump. It can affect libido. It can, we can have some depression and anxiety. We crave more sugar, starches, salty foods. And they say 23 through 2/3 of the patients report that to their doctors that they have some stress in a regular office visit.
Dr. Pam, quick question.
Yes.
Do you think that our screen time, so our computers and our cell phones, do you think that has impact also on our adrenals?
I do. I think that, it is a lot of stress with the electromagnetic waves and everything bouncing off of us on our body. So in the treatment, I think it's important to have time to unplug, that we turn off our ring or unplug our phone, not to keep our phone, too close to the bedside when we sleep. And, some people fall asleep with the television on and light on and other things, and all of that can affect, our adrenal balance.
Okay.
So, how do we diagnose adrenal fatigue? Well, Dr. Wilson, who's still alive, he has supported the use of saliva tests, which I have used for years. I don't test hormones or cortisol with the blood test because I don't see them as helpful. But what I do is a saliva test, and through our saliva, we can get the free levels of hormones that are delivered to our salivary glands, and that's what's delivered to the tissues. So that's a good level, and that gives you a more accurate level, I think. And also, they average the levels for the sex hormone, the estrogen, testosterone, DHEA. Now, for the cortisol, the different times a day you do the levels, you can get a level from the morning, midday, evening, and bedtime. So there's usually 4 levels that are done, and the cortisol level is usually highest in the morning and lowest in the evening or the middle of the night. And they say with people with adrenal fatigue, initially from stress, our cortisol level increases. And then as we continue to have stress, then the cortisol level starts going down, and we feel more out of gas and more prone to look for more caffeine and sugar and starches and maybe even alcohol to sleep or whatever to calm us down. And DHEA, dihydroepiandrosterone, is an androgen made in the adrenals, like testosterone. It's a little weaker, but also we look at that level. So these are helpful tests for me. Unfortunately, they're not usually covered by insurance, but I find them very helpful.
Yeah, most helpful things aren't. Karen Evans saying, I can't but wonder how I'm still living and relatively sane. 2 liters of Coke a day with my beverage of choice and a ton of other bad eating. So we have one confession among our listeners.
I appreciate her honesty. She is not alone. I mean, we're a caffeine-driven society, so many. I mean, that's why the coffee houses do so well, because, they get their charge of sugar and coffee.
Does that caffeine in coffee, the caffeine in coffee also, I guess, we're using it to charge our bodies up, but I guess it's also damaging the adrenal glands further. I mean, it's a processed food.
Yes, it's sort of whipping the adrenals, and it really is counterproductive. It can affect our sleep. It helps focus for a while, and then you usually have a drop, so if you do it early in the morning, maybe have a drop around 10 or so, 9, 10, depending what time you get up. And then you eat lunch, and sometime after lunch, and if it's a starchy, sugary lunch, or, with or without coffee or beverage, there's a slump after lunch that many people experience. Many people with adrenal fatigue may get their second wind maybe 6, 7 o'clock, and then maybe 9, 10 o'clock, are pooped out again. It just depends. But, also I didn't mention, but people on a different type of shift, like nurses or doctors that work night and day shift and go back and forth. It's very hard on the body to switch those, circadian rhythms, and change your sleep cycle like that.
Wow.
So,
we're looking at part 2, treatment of the adrenal glands. And so what we're going to do, we've kind of addressed the problem. And so what I want to do is go to a break, and then we will come back and come up with a solution to this problem. So stay tuned to the show. We're going to talk about treating adrenal glands. And I want to deal with my heart failure patients. I've got a bunch of questions that's come up. So I look forward to part 2. Y'all hang on with us. Okay, we're back here. So we're going to address treatment of adrenal gland insufficiency. As Dr. Atkins pointed out, it's a major problem. About 80% of the population have some form of adrenal gland insufficiency, and we tend to mask it with caffeine and other things. So what we want to do this next session is talk to you about how we can address this problem in a more beneficial way, other than masking it. So let's bring our panel back on. Welcome back. So we're going to go into part 2 and address the treatment of adrenal gland insufficiency. So again, 80%, I mean, I want to recap some things we talked about. The first half, 80%, that's a big number of us have some form of adrenal insufficiency. I have a lot of patients who complain of fatigue. And so we attribute to a lot of issues. They have a lot of things going on. And I would imagine that the adrenal gland insufficiency is kind of part of that issue. So what is the approach? How do we solve this problem? What's the nature of that, of the treatment that you recommend?
Yeah, well, I would just want to say, adrenal insufficiency many times is called Addison's disease. So we're talking about adrenal fatigue, which is that term coined by Dr. Wilson, but the adrenal fatigue. But I think, I see it and I believe it's real. And I think in my patient population, I do a lot of thyroid screening and thyroid balancing with more of a holistic approach. And when they need prescription treatment, I do more bioidentical thyroid. But what I found is, sometimes people will be very well balanced with their thyroid, and all of a sudden they come in, I'm like, what happened? And I find out there's been some major stressor in their life that has threw their thyroid out of balance. So in effort to look to balance the thyroid well, I was drawn to balancing the adrenals, because I found that the adrenals have to work well or balance or work better for the thyroid to work better, and sometimes and vice versa. So that's how I got more involved with balancing the adrenals. And so it's important to the approach for adrenal fatigue. Most holistic practitioners have more of a holistic approach. Now, some docs that do balance adrenals do use a corticosteroid to supply what they think is a low dose corticosteroid. I don't do that with my patients because I feel like I want to get down to the root cause and some of the things that I'm going to mention when we're doing the treatment here. But some doctors do low dose corticosteroids. My concern with corticosteroids, too much can raise the blood sugar, can affect the immune system, affect the joints, and et cetera, things like that. And if a patient is not diligent or taking it regularly, I don't want to take the risk of a suppression of the adrenals, or they stop abruptly and kind of crash. But so I have this more holistic approach. And so number one, can we start with number one? Or
Sure, absolutely.
Okay. All right. So stress reduction measures. I think this is the most important thing. No matter what we do, we need to nourish our body and to counteract stress. So this can be breathing exercises, deep breathing, slowly exercises that can be guided. There's a lot of apps that help do that. Biofeedback that helps manage breathing and helps lower blood pressure and slow the heart rate, meditation, yoga, listening to soothing music with your eyes closed, stretched out. I tell people this is not something you do at the computer or watching movies on TV. It's something you really decrease the stimulation. It could be taking a walk or sitting in the backyard. It could be something as simple as that.
How about one of those massage chairs? I've got one of those massage chairs. I kind of like that. That would fit in this category.
I think that would be great, and maybe include some soothing music with it. Usually not music with lyrics, but more instrumental music, and so not something very soothing. But I think that would be a good thing, and it doesn't have to be the same thing every day. You could vary it. Some women may be soaking in the bathtub or something like that, or like I said, or enjoying nature, for those that enjoy nature if they have a backyard or able to go to the park, etc., and do our grounding, as we mentioned before. I do have to mention that my husband, Dr. Floyd, he does those binaural beats. There's like a YouTube that has different sounds that you have access to that can be used for stress reduction, or there's one for depression or lowering blood pressure, anxiety, certain situations. But they have sounds or water sounds or tones, and are very soothing, or even problems falling asleep, So there are a lot of apps and things that are available. So secondly, just sleep hygiene. We want to have better sleep hygiene. We want to, number one, get sleep. And so, we want to focus on maybe 7-8 hours. Some adults, as we get older, we usually need a little bit less sleep. So some feel adequate sleep with 6 hours, but listen to your body. But being sleep deprived cumulatively can put stress on our body. We want to give time to wind down, to limit stimulation before we go to sleep, not to watch a horror movie or the news or things like that are very distressing before we go to sleep. We don't necessarily want to exercise before going to sleep because our body is not ready to rest after that. We want to sleep in a dark room. We want to stimulate melatonin. And so melatonin is stimulated when we're in darkness. And so even if you take melatonin, but you sleep in a room that has some light, like the lady in the picture, you may want to put some blinders on, or if you cannot, darken the room, and minimize noise as well. So have good sleep hygiene. You can always include your essential oils of lavender or lemongrass, put a little handkerchief in the pillow or something, or bathing or something where that has a very calming effect. So that's number 2.
So Karen says Yellow Brick Cinema has great sleep music. Is that what you listen to, Floyd?
I have about 5 channels I listen to. There are a lot of individual channels, but even when it comes to, like I said, relaxation, when it comes to sleep, when it comes to blood pressure, there are beats for everything. I just tell people, most of the beats last anywhere from 2 to 3 hours when you listen to them, but you just have to make sure you have the ones that don't give you subliminal messages while you listen to it. So I'm always aware of you have to know the channels to know what's going on. Yeah, Spiritual Tribe Awakenings is another channel for me with that, and they have great music. So, and it's like I say, it's a tone. One thing I tell people about it, some people listen to it through a speaker, but if you have earphones like this, you want to listen to headphones or earphones, because they give tones that are balanced, because you want to hear them in both ears at the same time. And the tones can have a healing effect. You can use it if you're healing from a disease or an illness, or you want to change your immune system. They have beats for immunity. They have for so many different choices. So it's something to explore.
And 528 hertz is a healing hertz if people are interested in just doing research on 528 hertz.
Yes.
Okay. I appreciate that's good information. It's good information. And Baxter, when you're on your massage chair, you could listen to some of these tones.
Get you some Beats headphones.
Yes. Okay. So number three, so number three is anti-inflammatory, unprocessed food diet with the emphasis on plant-based. We want to avoid, a lot of processed food, high fructose corn syrup, concentrated sugars, and high laden sodium food. We want to eliminate processed meats and embrace fresh vegetables and so we want to clean up our diet, more seeds and nuts and beans and things like that. But patients do well when they clean up their diet in regards to these kind of symptoms. Number four, we want to have regular exercise. And so if we're not exercising, start as simple as 10 or 15 minutes, something low impact. It could be as simple as taking a walk. It could be riding a bike or stationary bike. But we want to slowly increase it to 20, 30, maybe as many as 45 minutes. Some people go an hour. But I would say a minimum of 5 days a week. But it's good to have some movement every day. I mean, our muscles and joints still work. We can take a walk. We can ride a bike. I mean, I see in parks, where people that are Middle Eastern and Asian, many times the entire family walks. And I think that's a great habit to adopt after dinner or after a meal if we can walk.
Let me ask you, so on exercise, so what if someone's doing high impact exercise? Is that counterproductive?
Well, number one, we don't want to overdo it. Like some people, when they start, they want to become a weekend warrior and they hit it too hard and may injure themselves or have a problem. So we want to start slow, but low impact. I want to protect the joints because a lot of times when we're doing high impact and we're multiplying how we're striking our knees and our hips and our feet, and we can cause more damage to our joints. So that's why we prefer low impact. To not create new problems.
Joints were okay. I mean, we as long as the joints are okay, the adrenals are okay.
Well, the joints, we want to do a soft surface. So if somebody jogs or walks, we want to walk on a softer surface like a track or grass or dirt as opposed to cement. That's hard on the joints. And so some people do rebounder in front of the TV as long as they have good balance, that they're not going to hurt themselves. But we want to be mindful of being gentle to the joints so our joints will take care of us as we get older. All right. And so we want to avoid toxic relationships and toxic environments. I mean, sometimes we can't avoid toxic people and toxic relationships. It can be our job environment, it can be our home environment, our loved ones, but we have to minimize it as much as we can because that can really destroy our balance. And so going through toxic relationships or marriage or things like that, that can be challenging. So we want to get help for that. I do recommend a high potency, good, preferably organic multivitamin, trying to avoid a lot of the excessive synthetic vitamins that are out there. I usually recommend a twice a day dose, vitamin and should I say, and mineral. But I think that's important as well. Next, I think it's really important to have herbal supplements. I don't think we have to do all of these, but herbal supplements that help the adrenals are usually called adaptogens, meaning if the adrenals are low and cortisol's low, it helps bring it up. If the cortisol's too low, helps bring it down. It regulates. Well, there's a lot of wonderful adrenal or adaptive hormones. Astragalus is one, great for the immune system, great for antiviral during this period as well. Maca is great for men and women. It can help with sexual health and libido for men and women, but it is it's adapted. It's great for the adrenals. The maca, sometimes you'll see on maca, they say It's regarded as caution or not recommended for people with thyroid. What I recommend is a maca by a company called Whole World Botanicals, and I don't have any interest in that company, but they get the South American Peruvian herb, but they heat treat it like the native people have done for years, and that prevents it having that goitrogenic or thyroid interfering with the thyroid function. So they have a great maca product. Ashwagandha, Whole World Botanicals.
Botanicals, okay.
Yeah, Whole World Botanicals, and the ashwagandha. It smells sort of like a camel, and it has the worst taste worst taste. But when you look at all the benefits, it has a lot of great benefits. You can get it in powder and capsule. For people that can't take the bitter taste, and then I would, recommend doing the capsule. But ashwagandha, if you look at this, many times anti-inflammatory, may help for, even diabetes, not just adrenals and things like that. Great supplement. Cordyceps and reishi are mushrooms, but are medicinal mushrooms, and they can be very helpful for the adrenals and for the immune system. I think cordyceps, has some benefits for when the renal insufficiency, etc. There have been some studies that have been helpful on that. Holy basil is great for the immune system and adrenal fatigue. Ginseng as well. And, there's a product we use to have a combination of a couple of these in it, but these are all great supplements. And I'm sure some of our listeners may be familiar with some of them. Vitamin D, I think it's always important to take for immune system or overall health. And the range I usually recommend when you get your blood test to focus to get it 60 to 80. But I don't know why I put ginseng in there, but great for COVID-19. If you have COVID or trying to prevent COVID, there are studies that show at least 70, 71 or higher are good numbers to protect against COVID. So those lower numbers in the vitamin D3 that may be normal is like 30 to 100 on a test, but may not be as protective of COVID. But we find that it's coming out in the past few months that patients that are not vitamin D deficient and have optimal vitamin D levels do better with COVID. And probiotics we've discussed in other shows are always helpful, and especially if there's a history of taking antibiotics, history of corticosteroid exposure, or eating animal products where you're getting antibiotics indirectly that were fed to the animals. So probiotics are also very important. I also, recommend, unplugging, as I mentioned, unplugging when we go to sleep, unplugging, not to have the cell phone right close to our head, turn it off, turn it down, but try not to charge it close to your bedside when you go to sleep, and try to minimize all the electrical things and computers and things by our bedside when we go to sleep. I did have an example of a hormone test, a saliva hormone test, and I just wanted to bring up a couple points, unless there's some questions about the treatment right now.
Well, back to the herbs, you mentioned the adaptogens. Is there one that's better than the other? You mentioned you have a supplement that does a combination of them. Somebody says ginseng. I guess it depends on what your issues are, but is there a feeling that you should rotate among all of them, get one that you like, or what are your thoughts on the adaptogens?
Yeah, I guess it's to see what works, but like we have one with cordyceps, ginseng, and I didn't put rhodiola here. Rhodiola is another one, but it's a combination of that one that is helpful. And when you have stressful situations or have to climb a mountain or physical exercise, you may want to, to take a supplement like that before a challenging time. But I usually have my patients with adrenal fatigue, take a supplement in the morning, and then maybe late afternoon, even early evening. But you want to be at least 4 hours away from bedtime, not to get a burst of energy when you want to sleep. But all of these are excellent. It's trial and error. The doctors or you have to see what works for yourself. But there's not one. All these are stars. But astragalus, I like maca, I like ashwagandha, is very bad tasting in the powder. It's hard to put in a smoothie, but you can encapsulate the powder, or if you can hold your nose and take it, it's great. But it's a wonderful thing. But
do you use vitamin C from time to time also, or is it
yes.
efficient?
Yes, I think vitamin C is great for immune support. It's not necessarily adaptogen, but it helps with the basic immune support. And many times the immune system has been affected with adrenal insufficiency. So vitamin C, a lot of times I add it to my patients. I'm not necessarily thinking as adrenal support, but it does help in the overall function, elimination, especially buffered vitamin C, alkalizing, etc.
Pat Brown wants to know if maca has caffeine in it. Interesting question. I didn't.
Not that I'm aware of. I don't think there's any caffeine in it, in maca. But I notice with the maca, I usually like to recommend it in the daytime. And when I take it in the daytime, I don't necessarily like it at night. I think some people get a burst of energy at night. I think it was ashwagandha. Some people get kind of drowsy taking it at night. So I think there's some type of, but I haven't heard about that in the daytime. But maca, I'm not aware of a caffeine component, but I can double check that.
Dr. Kim, I have a question for peds. So children are basically experiencing the same things. They are staying up late, or stressors with the pandemic, and the diet is highly processed. So what do you think about these herbs being used in pediatrics?
Well, I think, a lot of these, medicinal mushrooms, I think would be really safe. The cordyceps and the reishi, they're mushrooms. Shiitake is a medicinal mushroom that we can buy at the store, but I think that would be fine. Astragalus is wonderful for the immune system to fight colds and viruses, etc. You can, perhaps put it in smoothies and other things like that. So I think those would be fine for kids.
Okay.
As well as a little vitamin C and things like that, where we mentioned,
So Deborah, she likes ashwagandha. It helps with sleep and mental clarity the next day. So that's to your point with that. And Nicole, she puts ashwagandha in her coffee a couple of times and couldn't taste it. So wow, she loves ashwagandha. I guess.
What kind of coffee is that?
Yeah, I don't know if we can wean a little bit with the coffee, but don't overdo the coffee. But
counterproductive.
Yeah.
All right,
Yes.
So, but Karen Evans, so can I just use ginseng root as opposed to supplementing the herb? So she wants to know about the root versus the herb. I like to get as many of my vitamins and herbs and nutrients from food as much as possible. So the ginseng root, are there good sources or bad sources of the ginseng root? Are you getting as much as you need from the root versus the supplement?
Well, ginseng is a herb, and so so I think that's fine. Yeah,
It's the root is what we're getting with most ginseng is ground up root.
Yeah, so that's fine. That's fine.
Yeah. So just you can so the answer is yes, and then
Yes.
you like the root, and then you can take the capsule from around the powder, and you have the powdered root. So
Yeah,
good.
exactly. So
And probiotics is good. That was one that was a surprise that's new to me. Of course, a microbiome has a big effect on everything. So that's a good one that I think people need to make note of.
Yeah. So I just wanted to just to quickly look at a saliva test where you have the 4 different levels. And so mainly I'm going to focus on the bottom part, which is the DHEA, dihydroepiandrosterone, and cortisol, morning, noon, and afternoon. Well, this person did a DHEA, lady of 56 years old, and we see that her levels for DHEA was 78, 141, 84. Now this lab, each lab has different reference range. Their reference range was like 106 to 300. And so I usually like it within that range. So you see her DHEA had improved here. And I think when she came back, she had kind of slacked up on her adrenal support. Her cortisol started at 7.38, had improved to 11.47. But when she came back and had slacked up on her program, the cortisol in the morning, where it's supposed to be the highest, was 3.55. So the lab considers optimal range on this 18 to 35. And, I think at least 10 or 11 is moving in the right direction, although the average person's anywhere from 5 to 40. 5 is sort of on the low side, 40 is on the high side. So it just kind of gives you an idea how it varies with this person. Let me see if I can look at the lower part of this laboratory. But anyway, I have some kind of blocker in the way. Let me go back. And but I think her cortisol, the initial one, 0.92. The nighttime, you just want to make sure the cortisol is not super low, but it is not super high. So they consider optimal between 2 and I think it looks like 5 or 6. It's in small print for me too. But they say the average range is 0.9 to 0 to 2.2. So if the cortisol is too high at night, that may be preventing us from going to sleep and we may be too revved up. But this is an idea what the hormone tests look like. And, we can follow up on and compare in the future. I just wanted to, had a little case summary, and I just had one patient that in her late 40s and 50s, she was very resistant to weaning off of caffeine. She didn't want to, even though I encouraged her to. She drank a lot of Diet Colas, at least 4 a day, and she was stressed. Her husband had lost his job, and she became the sole supporter of the family. She admitted to some depression, but not suicidal. She was low energy, and she was very resistant to changing her diet and kind of self-defeating in her behavior, not taking her supplements as recommended, and she was a hypothyroid person, not consistent with her thyroid medication. But the last time I saw her, she recently had made changes. She was on a no processed food diet, whole food diet, she called it. She was weaning off of caffeine. She started an exercise program, and she was more consistent with her thyroid medication, and she was doing much better. She had lost weight. And so that was a good success story for her.
One question, Dr. Pamela.
Yes.
Did her husband get a job?
Yes, he eventually got a job, but we need to. Yeah, yes. But I'm trying to think if he had a job. Yeah, you think that? Well, I'm sure that was a major stressor.
I have to see it.
It helped her adrenals, but it probably knocked his down a little bit.
He's probably able to get out of the house and was a little bit better.
Wow. So this is a very, very enlightening story and presentation. The adrenal glands are so important, and I hope our listeners can really get a sense for how complex the problem is, because these symptoms are broad, and they can be secondary to any organ system. And the thing is that we have to consider the fact that there are a lot of diagnostic tests that have to be done. The adrenal glands, you can look at that complex report, but there's a lot that we have to do, and there are multiple factors and many things in our lives that can be affected. The soft drinks, the water we're drinking, our lives in terms of our work life, stress life. So we all have to consider every aspect of what we're doing. And the constant theme that we have on the show that we recommend is that, natural health is a process over time. It's a building process. So, what we're eating, how we're exercising, how we sleep, our work environment, the people, what we're reading, what we're listening to. And as you can tell from that presentation, there are multiple factors that have an impact on our adrenal glands and hence on our overall well-being and how we feel. So it's not like a one pill, like in medicine, like, okay, take this pill or, have this surgery or whatever the case is. Total health is a collective process. And so we have to be mindful of that. Whether we're having adrenal fatigue symptoms or not, we have to be mindful of the process of how we live and what we do to our bodies and how we maintain our bodies. So that was a major takeaway that I had from that presentation. Excellent presentation, Pam. Any other thoughts, comments? Here's a question from WJGC. Do you suggest these herbs with high blood pressure meds? I think it depends on the medications you're taking. And so most herbs are, okay with medications, but you just have to, it all depends. What's your take on it, Pam?
Yeah, I would say the medicinal mushrooms like the cordyceps, which is great for preventing renal insufficiency and maybe supporting that, which many hypertensive patients have. And the reishi is good. And so I think no problem. Some people take licorice for adrenals, but we caution people with hypertension, with adrenals and liver disease. So I think the ones I mentioned, the cordyceps, the reishi are good, and the reishi mushrooms and the maca usually are good choices. And I think when you look at some of them, I believe it could be astragalus, ashwagandha. It says it can help the blood pressure. So just look that up. But most of them
all
are.
this Granville is addicted to 3 or 4 cups of coffee a day. He can't function without it. So what advice do you have for Mr. Granville?
Well, there's hope. We need to wean. So I don't recommend cold turkey. So if you're used to 4 or 5 cups, 5 cups, decrease it to 4 cups, and then to 3 cups, and then to 2 cups or 1.5, to slowly step it down. And that would be a great way to do that. Some people do supplement sometimes with tea, like green tea or black tea, which has caffeine, but not as much as coffee. And so that's a way to step it down. But you don't want to get that rebound headache, that withdrawal headache. And so, but wean down off of it. Some people need to wean from sugar too, because sometimes they get the double whammy with the caffeine and the sugar, and the body's used to both. But there's hope.
Sound like you need some adrenal support also, huh?
Yes, it does. And taking supplements can help you support so you can back away from the wrong foods and the excessive caffeine.
Wow, that's a good point. Yeah, so weaning the caffeine with adrenal support can be helpful in that weaning process. That makes a lot of sense. Well, so we come to the end of our show. This is impressive. This is an amazing presentation. Thanks, Dr. Atkins. Really enjoyed this. It's very enlightening, especially in terms of, understanding our adrenal glands. And, one take home for me is 80% of the people, have this problem. And adrenal fatigue impacts us in so many different ways. You may have high blood pressure because you're not sleeping very well because of the adrenal fatigue. And so we may put you on 50, 5, 10 antihypertensives, but the adrenal glands may be off. And so there's a lot of, work that has to be done here in terms of how we care for our patients, certainly in terms of looking at the total body. And this adrenal fatigue is an area that really needs to be considered in everybody's clinical environment. So thank you again for that most enlightening presentation. And as I close out, I'll see you guys backstage. But again, I want to welcome everybody. Thanks for joining us the first show. Although those of you on Facebook can't see us, Facebook streaming somehow got mixed up. And so we will post it on Facebook, even though you can't hear me, but you will see it on Facebook. And the next show, we'll make sure we get that streaming issue fixed. But again, as always, we really like for you to, make note of this. Please like this show and share it, and also subscribe to the channel. This would be very helpful. And if you know someone, I'm sure with 80% of the population having adrenal fatigue, share this story with some loved one, because I think they can get a lot from it. This is something that you can inform your physician about, and I think it will benefit you and any loved one. So until next time, we want you to keep it fresh, natural, and alive. Thank you for watching.